Hi, so this video we will be focusing on the specific diagnosis for recurrent miscarriage. So if you know somebody or you yourself are experiencing repeated miscarriage for many years, it is highly likely that it is caused by an underlying immunological factor that many doctors and medical institutions do not know how to diagnose and treat. So here at Antai Hospital, we own the patents for this medical condition, the recurrent immunological miscarriage, and we are able to accurately and effectively diagnose and treat your condition. So the specific diagnosis indicator for a recurrent immunological miscarriage is the presence of a specific antibody in your bloodstream. This antibody is known as an anti-embryonic antibody, and it is a form of antinuclear antibody that acts on chromosomes inside the embryonic cells. So it is very tiny, smaller than normal antibodies. So if you have a history of induced abortions, sex during menses, childbirth, multiple failed IVFs, or unexplained infertility, you may have this condition of a recurrent immunological miscarriage. You might develop this condition because there's a high risk that these factors will cause the introduction of paternal genes, which means either sperm cells or fetal cells or embryonic cells that has entered into the mother's bloodstream, causing the mother's immunological immune system to develop these antibodies to attack the embryo or the pregnancy in your subsequent pregnancy, which is why you see yourself constantly miscarrying. So if you don't get this condition diagnosed and treated quickly, your miscarriage, not only does it continue to happen, it will happen faster than your previous one. So it will happen earlier and earlier in your pregnancy to the extent that it might become a chemical pregnancy where the miscarriage happens in the 3rd or 4th week. So it's a very, very early miscarriage now. So if you know anybody who has this condition, quickly get them to get diagnosed and treated. So to diagnose this condition, Antai Hospital just needs 5 millimeters of the patient's venous blood sample, and we will give you the results of the blood test on the day itself. As long as there is a detected presence of this anti-embryonic antibody in your bloodstream, the results will come up positive and you will get diagnosed and you can get treated. So I hope this video can give you an awareness and an understanding that this type of condition, also known as unexplained recurrent miscarriage, actually can be explained and can be diagnosed. So share this video to anybody who has experience of recurrent miscarriage and wants to get a healthy pregnancy. Let them know that this condition can be diagnosed and we also offer effective treatment.